and physiotherapists achieve their passions and dreams by educating and training them. Talking about our academic heads, first of all, I'll introduce you all to Dr. Snigdha Sharma. She is the academic head medical courses at our organization. She has completed her MBBS and MD gold medalist from Christian Medical College and Hospital, Ludhiana, India. With over
your screen is not the screen is not visible.
Okay,
Snigdha, madam.
Yeah. Okay. Is it not visible now, sir?
Dr. Snigdha's screen.
The slide. You need to change the slide.
Okay, 1 second. Can you check now, sir? Is it visible?
Not yet, Dr. Sonal.
Okay. I will just present it again, sir. So it may be because of the network issue. Actually, the weather is quite bad over here. So
that's okay. That's okay.
Yeah. Is it visible now, sir?
The screen is visible. The slide is not.
Okay. And if I present it like this, is it visible? Let me share it again.
Yeah, please reshare.
Is it visible now?
Yes. Yes, Sonal.
Thank you.
But Dr. Sonal, it is not in the presentation mode.
Yes, I'll just present it in the presentation.
Okay.
Yeah.
Better. Yeah.
Better? Okay.
Yes.
So, ma'am, shall I start from this particular
section? You can start from here. Yeah.
Okay. Thank you so much, ma'am. Thank you so much, sir. Yes. So sorry for the interruption. There was some sort of technical issue. Let's come back. So as we were discussing, we were talking about our academic heads. So introducing our first academic head to all of you, Dr. Snigdha Sharma. As I told, she is the academic head medical courses at Academically. She has completed her MBBS and MD from Christian Medical College and Hospital, Ludhiana. With over 10 years of extensive experience, Dr. Snigdha brings a wealth of experience in medical research, data analysis, and primary healthcare, amongst other skills that she possesses. She is also a USMLE qualified doctor. Talking about our next academic head, Dr. Kamlesh Soni. Sir serves as the academic head at Academically, providing invaluable guidance and expertise across all our courses and mentorship programs. With a PhD in medicinal chemistry from India's premium institute, Central Drug Research Institute, CDRI, and more than 15 years of professional experience, Dr. Soni brings a wealth of knowledge to our academic endeavors. Talking about our ADC faculties, first we have Dr. Ankita Arora. She is BDS MDS Periodontics, Dr. Chandni Shri, and Dr. Priyanka Rawat, MDS AIMS New Delhi. These are the guiding persons of our ADC exam course. Now comes the question, why choose Australia? 1,85,000 visa offers, 3,000 plus job vacancies, 1,80,000 AUD Australian dollars plus average annual salary is what you get in Australia if you choose Australia to be your career place for dentistry. Here is one of the testament of it. Dentists improve quality of life for patients by treating and helping to prevent diseases of the teeth, gums, and mouth. You can see the job opportunities. Right now in Australia, you have 2,454 job opportunities as a general dentist, wherein the salary amounts to $185K, which is a typical salary in Australia. You can see the job growth, which ranges about 27.8%. Job satisfaction, 3.9 is the review which you have. Talking specifically about the benefits for dentists in Australia, first, higher earning potential. So first things first, everyone, the jobs in Australia offer huge salaries to dentists, huge salaries, which I have literally quoted in the previous slide of mine. Talking about the quality of life, Australia is known for its high standard of living, excellent healthcare, diverse culture, making it an attractive destination for many people. Career opportunities, there is a high demand for dentists in Australia, along with perks such as instant PR and work visas. Work-life balance. So this is something which all the professionals always want to have, right? So talking about Australia, yes, Australia has a good work-life balance, which can help dentists manage their workload and maintain a healthy lifestyle. Professional development. Dentists in Australia have access to ongoing professional development opportunities and advanced medical technologies, which can help them advance their skills and knowledge. Free education and healthcare access. Now, this is also something which Australia as a country caters to. Australia offers several perks, everyone, to the residents, such as free education for children and free healthcare access. So not only you, but also your family will be benefited over there. Now, let's come back to the main purpose of our webinar, that is the ADC exam. What is the ADC exam? The ADC exam, administered by the Australian Dental Council, is the exam you need to clear to become a registered general dentist, or rather a registered dentist in Australia. Skilled and qualified dentists from all over the world can take this exam in their home countries. I repeat, you can take this exam in your own home country. Clearing the ADC exam is the first step to landing a dentist job in Australia. Both written and practical examinations must be successfully completed before the candidate applies for registration with the Dental Board of Australia, the DBA. Talking about the eligibility criteria, you just require a dental degree from a recognized university of 4 years from your country and full and unrestricted registration in your home country or country of training with no withdrawal of the registration. About the ADC exam, if you talk about our country, India, these are the exam centers right in front of you on your screens. The exam is conducted in Hyderabad, Pune, Surat, Ahmedabad, Mumbai, Noida, Chennai, Bangalore, Gurugram, Jalandhar, Amritsar, and Chennai. So whenever you book your exam, you can choose any of these exam centers and you can sit and give your exam from India itself. Talking about the exam dates. So guys, the ADC exam is conducted twice a year. So you have 2 opportunities in 1 year to sit for the examination. First, March, second, September. For 2024, like this year, the exam dates were Wednesday 13 and Thursday 14 March 2024. And talking about September, which is yet to arrive, Wednesday 11th and Thursday 12 September 2024 is the exam dates. March 2025 date is yet to be released. How is the exam conducted? The ADC exam is divided into 2 parts. First of all, you have the ADC written exam, and then second part is the ADC practical exam. So for the first time when you sit for the examination, they'll test your theoretical knowledge, which will be roundabout be a case-based scenario kind of thing. And then you literally need to show your hand skills. So your practical exam is conducted as the second part of the ADC exam. While the written exam can be attended from the exam centers in India, the practical exams need to be taken from Australia. So in Melbourne, you have the ADC center. Then you have to go and sit for the practical examination. You have mannequin, you have patients, and you have to basically showcase your clinical knowledge over there. Steps towards the dream. First of all, to be eligible for the ADC examination, you need to submit your documents, which is basically called as the initial skill assessment. Once that is scrutinized, they'll basically tell you that yes, you are eligible to sit for the examination. wherein after that, you will be sitting for the ADC written examination. You have a limited registration for that. So it's always good to do it, in advance. Third, English proficiency test, which is definitely required. And fourth is the ADC practical examination, after which you can apply for the full registration over there. Skill assessment requirements. So what are the documents basically which you need to be ready with to be, capable to sit for the ADC exam? Number one is the BDS or MDS degree of yours. Second, the transcript. Third, work experience evidence if you have any. Fourth, your valid passport. Fifth, your government ID proof. Sixth, passport size photograph. Seventh, dental registration certificate. And last but not the least, a good standing certificate of yours. The English proficiency requirements, you can be proficient in any three of these, be it IELTS, PTE or OET. For IELTS, your individual band score has to be at least 7, PTE minimum score of 65, and OET a minimum score of 350 out of 500 or grade B to sit for the ADC exam. Now, what are the features of the ADC exam? Number one, total of 280 questions across 4 sections with 70 questions in each section. So what happens is you will be allocated a period of 2 hours to complete each section. 2 sections will be scheduled on day 1 and 2 sections will be scheduled on day 2. So your ADC part 1 examination is conducted for 2 days. Okay. On the first day, you'll be having a 2 hours paper comprising 70 questions. You have a break, again a 2 hours paper comprising 70 questions. Day 2, the same thing. So total 4 sections, 2 hours each, 70, 70, 70, 70, 280 questions. This is your entire program for the ADC part 1 exam. Total time duration, as we can see, is 8 hours. Result will be published in grades. So in order to pass the examination, you need to acquire A or B grade. Okay. If you get A grade, clear-cut pass. B grade, clear-cut pass. There is no negative marking for the examination, which is one of the greatest advantage which you get for the ADC written exam. And the duration of preparation is 16 weeks, which we offer here in Academically. Expression of interest, eligible for permanent visa, 190 PR visa. You also get your sponsored visa. You have 482 visa, which is 1 year experience required visa. 494 visa, 3-year experience required. 491 visa, regional sponsored PR visa. And 407 is the training visa. Note, the experience required for the 482 visa will be reduced to 1 year, which is effective from coming November 2024. About the ADC preparation course by Academically, I would please ask all of you to pay a little more attention to this particular slide. The ADC preparation course by Academically is a resourceful course for global dentists to help them clear the Australian Dental Council exam. Everyone, the sole aim of the course is to provide all the necessary study materials, mock exams, and support for the students to ace this exam with flying colors. Experienced course instructors have curated a well-structured curriculum for you all and a systematic approach to ensure a thorough understanding of the exam content. Program highlights of ours: you have an instructor-led and self-paced content, one-on-one mentoring support, extended access to content, flexible schedule of yours because definitely you guys are working professionals, periodic webinars from the industry mentors like we are having right now, feedback and assessment, tips on CV writing and cover letter generation, and placement and visa support. Talking about our fee structure, step 1, initial assessment. This is our fee structure. For the ADC 1 exam, AUD 2122. This is not our fee structure. Basically, it's the government fee structure of ADC. Initial skill assessment, you are charged 647 AUD. ADC 1 exam, by the ADC, you are charged AUD 2122. For PT preparation, around 300 AUD is what is being charged from us. And ADC 2 exam, AUD 4775 is the cost which the ADC Council or the Australian Dental Council charges you. Why trust Academically? First of all, reputation and legacy. 650 plus positive reviews and greater than 90% success rate is what we have achieved here in Academically. Faculty profile, highly experienced and qualified faculty who have undergone a similar journey. Course content, high quality, researched and precise content in accordance with strategies to clear exams. We here at Academically have a strong alumni network, a community of hundreds of ex-students who are successfully placed in their careers. Personalized approach Academically provides constant counseling, mentorship, and motivation. And last but not the least, if you are still confused, visit our office in Australia or India to discuss with Dr. Akram and the team all of your queries and concerns. We would be happy to hear you out. Talking about our features, so we have featured in Farmer Tutor, Economic Times, News Nation, featured in Outlook, in Hindustan Times Magazine, Economic Times Magazine, and Times of India Magazine. You can also find us on Google. This is the review which we have. So you can visit our website and look at the Academically Global Review. Talking about the financial assistance. So we not only cater to the exam course preparation, but also we help for your financial assistance, interest-free loan and EMI. So we have collaborated with EduOnes, and in association with them, we provide interest-free loans with 12 months easy EMI option to all our students so that they can fully focus on their studies and preparations without worrying about finances. We have also partnered with Kuhu Edu Fintech, an online platform that provides fast and easy student loans to students whose financial burdens weigh down their dreams of becoming registered healthcare professionals overseas. Scholarship, yes, we at Academically also offer scholarship to you guys. Academically scholarship for a broad program, which we call as ASAP. Definitely, we understand the importance of empowering dedicated and talented students, and thus we offer huge fee waivers and scholarships to deserving candidates via our ASAP scholarship program. Very easy 4 steps to avail our scholarship. Number 1, visit our website, register for the test, clear the test with the required result, and bang on, you back the scholarship. Talking about the Med Connect, so we have organized, or we are rather going to organize a special program for all of you all, which we are calling as Med Connect with Dr. Akram. Our CEO, Dr. Akram, will be available in person. It's a global healthcare career launchpad. So as you all can see on your screen, we have our events in Chandigarh on 8 September from 10 a.m. to 6 p.m. Hyderabad, 12 September from 10 a.m. to 6 p.m. again. Pune, 22nd September on the same time, and Cochin, 29 September. So you can join us for a transformative conversation with international healthcare career coach and our CEO, Dr. Akram Ahmad. He'll be there in person and you can join. It's for free. Just come here, tell us your queries, discuss your concerns, and we are happy to help you. Also, when you sit and when you join us for the Med Connect, we will also be offering all of you all certificates for your participation. Talking about our social media handles, we are available on the Instagram with the name of Academically.Australia and also Academically.MedPrep. So you can also follow us over there and get to know all the information which has been shared on our social media platform. We are also available on YouTube. Dr. Akram has his own YouTube channel. So whatever queries or whatever information you want to gather, you can also connect over there. And this is our contact credential. You can anytime reach out to us. And as of now, this is what was the PPT of ours. And we would now move to the questionnaire round of ours. We would be happy to answer your question. So you can just, first of all, I would request all of you to please drop your name and your phone numbers on the chat box. And then you can raise your hands one by one. We can take your queries and we'll be happy to answer. Please raise your hand for your queries and concerns, everyone. Yes, Nashwa, you can please unmute yourself and you can ask your query.
Hello.
Hi, please go ahead with your question.
Okay, so my question was, I've heard a lot that you need a stronger CV in order to get jobs after you pass the ADC. That requires an extensive research background and a lot of impressive things in your CV. I want to ask if that's true or not, or you can get a job after you just pass the ADC.
Hi, Natwa. Yes, you can get a job after AMC too, you know. If you want to do like in PG or higher studies, obviously they need very strong CV.
Nashwa, is your question answered?
Yes, it is. Thank you.
Thank you. You can please keep your hand down so that we can take up the other person. Okay, I have Tanu Sheikh. Yes, Tanu, please unmute yourself and ask your query.
Hello, am I audible?
Yes,
Yes,
you are.
Pramod.
Good evening, sir. Good evening, ma'am. So I wanted to ask whether, like, after completing my masters, I have done my masters in prosthodontics. So can I register as a specialist there in ADC?
No. The Indian degree is not recognized in Australia. There is certain reasons. That is first reason that the Indian degree have only 3 years, while in Australia it is a 4 to 6 years degree. Okay. To complete your residency, especially in US, in Australia. They are not recognizing. So you need to go to ADC and become a general dentist in Australia. And then if you want to again, want to do further, PD in your own field, you can get the admission there.
Okay, I'll have to redo the MBS thing there.
Yes, yes.
Okay. Okay, sir. So will my experience be counted for like 3 years?
Yes, yes. Experience will be
That will
counted.
be
This will be advantage for you to get a job. Even if you want to do in future also koi study, even if you want to do PhD also, you can do, So a lot of things you can do since you already have a PG, and it will be easier for you. Job मिलना आपको easy रहेगा in general. और additionally आपको help रहेगा, But जो degree है MDS का वो recognize नहीं है ऑस्ट्रेलिया में. That's why they are not recognizing your degree. Yeah.
okay. Okay, sir. Thank you so much, sir.
Thank you. Yes, Sonal. Anyone else?
Yes, I'll just
Hello,
ask.
sir.
Tanu, if your question is answered, you can please keep your hand down. Yes, Fawad, please go ahead. Unmute yourself and ask us.
Sir, I have just two questions regarding the ADC exam. May I give this exam, the ADC Part 1 exam from Pakistan?
There is no exam center in Pakistan. So you need to see nearby country where is the center, you can go and sit in the exam.
So I have to go then Dubai, sir, for the ADC Part 1 exam.
Wherever you can write in Middle East, you can go to Singapore, there are so many countries. So you have to see where you can get the visa, so you can sit in the exam.
Okay, sir. And sir, the second thing is that about the total cost of the ADC exam, sir, because we haven't seen the slides and they were just rushed and we haven't seen it, sir.
So you can go and watch again, or Sonal, you can just can you please show again the fees part? You can anyone
Okay, sir.
can
Thank you.
right here. You can take the screenshot. You will have a clear idea.
I'll just share my screen, sir.
Yes. Any other guys? Any other question? Yes, Hamza.
Hi, good evening.
Good evening.
Hi, so there was this one presentation slide where it said that you can get a 190 visa, right, after we clear our exam. But recently I've checked on their government official website, and it says that it's no more a requirement to get a 190 visa. Like you can't get a 190 visa.
Yes. You are right. Basically, our team basically, they are basically presenting the old slide. So I already gave the instruction last week. It is changed. 190 they removed. Now only 491 you can take. 190 is no more for dentists for this year. They make us
Okay,
new
and
for year or something.
okay, and how much of an easy pathway is going on that 491 visa? Like, is it a straight pathway, or do we need like exceptionally documents and?
It is just a 5 year. If you are getting invitation, you need to pass both exams, get full registration, then you need to apply EOI, expression of interest. And once you are receiving test that EOI, I mean expression of interest, Invitation, once you receive, then you need to file your visa. This is very straight away. The state will given by this visa. So even there's no need to have any job offer to apply for 91 visa.
Okay, thank you.
And this is visa for 5 years. So you need to live and work for 3 years in the regional area in Australia. Then you can apply PR visa of 191. Okay. And once you got 191 and total 3 years if you are living in Australia, and then you can apply your citizenship.
All right, thank you so much.
Thank you.
Thank you, Hamza. We next have Firoz. Yes, Firoz, please unmute yourself and ask your doubt.
Yeah, good evening. Yeah, just wanted to know like how easy to get the visas and all, though if you're having the experience of 5 to 6 years after doing the BDS.
Getting a
So
visa,
what is the probability?
it doesn't matter on your experience. They will see overall your points. Point based on your age,
Okay.
your experience, your education, and you are a single or married or a partner. There's so many other factors are impacting for the application. It is not just the experience. You need to check if you have a good point. There's a high chance to get a visa. So in simple, all dentists basically they pass the exam and then they will apply for EOI. But at the time of EOI, your competition among all the dentists. So for example, there 10 dentists pass the ADC exam and they will apply. So if you have a high point or you have a similar point, they will give you the preference.
Okay, thank you. And normally in each year, like how much quota or how much visa they reserve for the international students or the...
This is 185,000. It is for international candidates only. So this is not for dentistry or pharmacy or medical or engineer. This is for overall 185,000 PR visa they will give.
Okay.
Yeah. Yes.
Okay, thank you.
Thank you, Firoz.
Hello.
Before I take up the other question, everyone, I would request all of you to please drop your name and your contact number in the chat box so that we can connect with you all if you have any sort of queries or concern. Yes, next we have Tanu. Tanu, please unmute yourself and ask your query.
Hello, sir. So I wanted to know, so what is the difficulty level for this exam? Is it like at the level of what India gives the NEET exam and all, or it's difficult than that?
I can say easier than that NEET PG, but obviously the questions is coming from your whatever you study in your undergrad degree in dentistry. तो जो भी आपने
Okay,
अप्लाई किया है BDS में उसी सिलेबस से ही आना एग्जाम, कोई बाहर से नहीं आएगा. But moreover, they are more focusing on the clinical part. जो practice based ज्यादा questions इसमें आएंगे.
Sir, how about the practical exam? Is it difficult than what we do in India?
This is
The
OSCE
precision
exam
oncology?
basically, nothing difficult to read. This is OSCE exam. So the problem Indian doctors, they are not practice about the OSCE, so they are scared about this OSCE. So if you can go through the OSCE process, if you're going to study very well, so easily you can crack. So worldwide, whatever exam, part 2 exam, so whether it is for medical doctors, dentists, pharmacists, nurse, physiotherapists, all has to go for this OSCE exam part 2. The part 2 जो एग्जाम होता है क्लिनिकल का, सारे हेल्थ के प्रोफेशनल्स के लिए OSCE एग्जाम होता है ऑस्ट्रेलिया में. कि नॉट जस्ट ऑस्ट्रेलिया, यूके में वही होता है. मैक्सिमम कंट्रीज में OSCE एग्जाम होता है पार्ट 2 का. तो प्रॉब्लम क्या है, हमारे जो सिलेबस है इंडिया का वहाँ OSCE होता ही नहीं है, तो इसलिए लोगों को लगता है ये बहुत ही टफ एग्जाम है, बट आई कैन से इट्स मॉडरेट एग्जाम, बट इतना इजी एग्जाम भी नहीं है और ऐसा इट्स लाइक नॉट ए इम्पॉसिबल एग्जाम यू कैन डू. बहुत सारे डेंटिस्ट यहाँ पे ऑलरेडी प्रैक्टिस कर रहे हैं, वो इंडियन ग्रेजुएट्स हैं.
Okay.
Yes, Tanu, I would just like to add something to what Sir said. If you talk about the practical examinations, if you talk about the ADC Part 1 examination, you have all the subjects, whatever you have studied in BDS, from there, jaisa ki Sir ne bola, you have the questions from there, okay? Part 2, if you talk about, you basically have to showcase your clinical and technical skills. Wherein, in short, I can tell you, endodontic access preparation, resin composite restoration, amalgam restoration. So these are the things which they basically ask you, which is very basic.
But it must be at a microscopic level, the cavity preparation, the access opening. Is it
not at a very microscopic level? But yes, that is something which you can definitely do, cater to. It's not something which you have not learned in your BDS course. Okay.
Okay. So, can I apply for the March exam now? If I start preparing now, can I apply for the next year 2025 exam?
Definitely you can. For that, you need to connect with our team. Please leave your number and your name in the chat box. Our
Yeah,
team will give you.
my name is Dr. Taranum. I've left a message there.
Okay, thank you so much. They'll definitely connect with you. Our team will
Sure,
definitely connect with
sure.
you. Okay.
So
And you
thank
can
you
get
so much for the guidance, ma'am. Thank you so much for the guidance. It was nice talking. I really wanted to explore few opportunities abroad, and this
Okay.
webinar was
Thank
quite
you, Tanu.
helpful that ways. Thank you.
Thank you, Tanu. Do we have someone else? Please raise your hand if you have any other query. No one? Guys, if you have any sort of query, please ask right now. Since you all are there, you are a part of the webinar, please take this opportunity and ask all